I think we have almost everyone back, and I'm going to actually hand it over here to the wonderful Haley Thompson. You're going to help us.
Okay, I'm going to bring it all together.
Wait, did I mess this up already? Is it?
No, it doesn't matter. Look, I can move on the fly. It does not matter. So actually, we were having a really great conversation. I take, I moderate and take notes at the same time. I like that because it helps me process things. So I love what came out of our group. So why don't we do this? So how much time do we have, Alex, for some type of wrap up of today?
We have until 7:55.
All right, so that gives a good amount of time. So why don't we do this? Can we go to each of the breakout rooms? Each group had at least a note taker, and we're going to be putting you on the spot a little bit, but don't feel pressured. We're all friends here. We spent 3 hours together, so we're all buddies now. So maybe you could report out from the breakout rooms. Is that okay? How does that sound, Madiha and Maha?
That sounds good.
Sounds great.
So again, briefly, you don't have to spend a lot of time on it. So what's group one or anybody, any note taker?
I'll volunteer, Haley.
Go for it.
Okay, I don't know what number group we are, but so pulling up my
We're group one, Carrie. We're group one.
Oh, well, look at that. We're going in order. So I have our action items that came up in our Google Docs. Thanks, Alex, for creating these Google Docs. And in case you're not aware, even if you don't report on everything that came out of your group discussion, we're going to take all of these notes and spend some time combing through them to find overarching themes. And so there's nothing wasted, whether that's tonight or tomorrow. If you don't feel like the whole group got heard, this is not for naught. So we will be using those notes. So thanks to our moderators also and our note takers for contributing as well. So I was the moderator / note taker. So these are a little clumsy, but here's what we learned overarching themes. First of all, to start at the very beginning of the program, when Maha shared those definitions, people were really glad to hear those definitions and wanted more awareness and those to be elevated. And overall, the feeling was there needs to be more dialogue and work around that, right? Because not everybody's operating from the same place. So we do have that as a shared document that Maha and I think Dalia contributed to as well. And so maybe we could add that to one of our checkup websites so that can be something continually evolved. So thanks for your work, Maha and Dalia, and creating that. I think is a great jumping off point. Besides the definitions, more data and research is needed, right? There's this conundrum of how do you involve people or make a case that you need to create a research project without the stats, right, to make the case for why that project should be conducted. And we had some talk about the importance of creating projects that are sensitized to the population at hand and the importance of involvement of community partners in the research for those reasons, and not only just compensating those contributors, but also acknowledging who's contributing to those projects and the importance of it. And then finally, we talked about care and the social determinants of health that might be overlooked in care, and including financial, transportation barriers, education, and that more care needs to be, more training maybe would help address those issues. So that was long-winded. I'm going to stop there. And if anybody in my groups wants to chime in, please do. And then also, Madiha did not plug, but just wanted to note the Arab Health Summit is forthcoming. So I hope I got that, Madiha.
Yeah, no, I was just gonna say, we did touch a little bit about how nonprofits, we are community organizations. Our time is valuable, and places like Access, we like to work with academic partners that value our time and respect our time and compensate appropriately, and not just compensate, but also include us as co-investigators, because if we want impactful community engaged research, we need to get the community off the menu and at the table. And that's what I think this symposium does. So we're hoping we can build more on that. And I really hope that, I know we talked, Haley and I have spoken, and our planning committee has spoken about this, that some of the work that's been done here can be poured into the next Arab Health Summit, which will be in 2024 in the beginning of the year. And I don't have anything more than that right now.
Thank you for that. Yeah, please use this and anything we're doing here to support the summit and the work that's associated with that. Any other group, any other note taker want to report out? Thank you for Carrie for sharing that.
So Dr. Thompson, it's Yolanda.
Hi.
Hey, so I don't know what group number I was in, but
Doesn't matter.
I'm sure it was the best group. I'm joking, other groups. But we had, a lot. Carrie, you're gonna hear from our note taker, Ali, I think is his name, and we had a lot of very similar conversations, as you were saying, around data and evaluation and what's needed, and setting and understanding the model for going for those smaller. Oh, thank you for letting me start my video.
I'm so sorry, Yolanda.
Going for those smaller pots of money, because a lot of times when you don't have data to show NIH that you don't have data, or if you're not a big enough organization, you don't get the R01, R21, and all the other R fundings from NIH. So starting with smaller groups, smaller funding pots, foundations who might have interest. Lisa was even talking specifically about special funds that could be set up to achieve those things, and we were saying we sure Dr. Thompson has the model for how you start small and move into larger pots. But I think the other thing that I just like to point out, because other things were similar that you mentioned, Carrie, is that there was a lot of conversation in our group about not just next steps in terms of we want to know where the next meeting is, but real true next steps that speak to being transparent. Groups like this come together and then we hear nothing. So we were even talking about what would the students' roles be? How could we start like an action team? And again, Ali, jump in, because I know I'm meshing these notes, but how could we start an action team or task force that would require transparency after meetings like this? And the transparency being, where are you taking this information? What are you doing with it? And with stopping the regular or the usual actions of groups starting programs and receiving funding about the MENA region, but without the MENA region or any minority group for that topic. So Dr. Hammami, Lisa, or Ali, anybody else that was in my group, feel free to jump in, but we had great conversation all throughout.
Thank you. I appreciate that call for accountability, because again, as you said, we want to continue this work afterwards. So and in terms of even these notes, they're going to be shared back with the group and put on their website and made available for, not only the folks who are interested in this topic here at Wayne State or these community stakeholders, they can be potentially used by other universities and other entities in our region. So because it's going to take all these different parties to kind of get this work done. So thank you for that. And I like the way you're conceiving it. So if you have any other kind of specific feedback after the fact about how to make those action teams and work groups stronger, we welcome that. Any other groups want to report out?
Yes, I can report from our group, and Madeline Wagner, she's our note taker, can help reminding me with stuff. Wasim had to leave, so I'm taking over his role here. So we also had a great discussions around the topics for the presentations. I'm just gonna share what we talked about in the last session, mental health and stress. And we had a great discussion about we really need to look at resiliency and strength within our groups and the community we serve, not only focusing on deficits and finding what's wrong, but also how they are resilient and empowering people. So we need to empower the community and not only, focusing on, let's say, the negative part. So that was great point of view. Also, the need for more collaboration and more data was consistent through our discussion in the three topics. Like, we need to know more, we need to have more data to build on, and how we can foster that. We also had a great discussion regarding food and disease and how that can be different for the MENA group, and how that might be something we can focus on and create more healthy individuals. Maddie, do you have anything else to add?
Yeah, so kind of from the first breakout session, we also kind of talked about clearly defining those populations and groups, but also moreover, like normalizing everyone to share their culture identity, creating a like a stigma, or eliminating the stigma around sharing. I identify as Arab American or African American, will help to bring forward some more resources and like more implementations kind of that you could use throughout the community in those under like communities anyway. Also, we said that in the dietary changes as well, focusing on total health and total wellness. That was kind of evident in all of them, even with the stress. Total health and total wellness is something to focus on, and those factors behind it are under-researched, and we talked about that a lot. Let me see what else here.
We also talked about looking across lifespan, especially for stress and health, and starting interventions as early as possible, and recognizing the differences of backgrounds people coming from. And definitely we had confirming note that we need those definitions, and we welcome others to ask questions about if they are not sure about those definitions and what they mean, and we can share and increase awareness. I think that's it for our group.
Thank you. Any other note takers or any other groups?
We basically talked about having more cultural centers and utilizing the existing infrastructure, more political involvement, doing more research, communication within a community, outside of a community. We talked about education basically and dissemination of knowledge. And when you're disseminating the knowledge, more cultural sensitivity. We also talked about community outreach programs, and we really talked about the cultural sensitivity part, is that when you're communicating to different groups, especially Arab Americans, you need to be able to speak their language. Somebody from our group addressed the fact that there are a lot of people that don't speak English and they don't understand it. So there need to be translators and everything. We also talked about more media representation, basically just getting the word out there, more activism about a topic. If you speak about a topic, you know what it is, then you can, make a difference. You can change it. You can do something about it. Yeah, that's what we talked about. We also talked about Wayne State partnering with more organizations, kind of like what the symposium is doing today. So yeah, that's what our group is about.
Thank you. Any other? Then there's group 5, and I know I was in group 6, I think. Any other note takers? Any other reporters? If not, there's probably somewhere out there, or maybe somebody had to step away and hopefully they have the notes. I'll just talk a little bit about our group. There are a lot of similar themes. The first theme was around data collection. And just doing a stronger job at data collection. And one of the thoughts that came to mind, just based on one of the presentations, was a good reminder. We have opportunities when we collect data in our research, especially if it's online work, and maybe harder when we're doing things on paper, when we're asking what people's background, and we ask if you're of MENA ancestry or so on, to really get more specific information about country of origin or specific ancestry, and to kind of track that. I think it's useful. I think, there's more of a tradition now, or more of a practice of doing that now with Latinx populations, where they ask, okay, where are you from? What is your background? And I think that's something important to remember when we're talking about MENA or Minari populations as well. So in terms of, I'm just going to go basically to our action steps. We talked about dissemination and implementation, thinking about like Dr. Jaber's work and the diabetes intervention. Where is it now? That's a huge problem we have in our field, is that we've kind of, we develop evidence-based interventions that work, and it takes a long time to move them into other clinical settings or other social service settings. So, that dissemination and implementation work is always important, because we want to, if there's something that works and something that makes sense to use, we want to make sure it moves throughout the community. Cultural adaptations, what are the lessons learned? What can we learn and apply when we're kind of doing adaptations for hypertension, interventions, or physical activity interventions? So I think there's, again, how can we share those lessons learned and disseminate those? Connections between research and practice to translation. So somebody, Dr. Aberley in our group asked about what are the safety net organizations and the clinics that, again, across our region that serve these diverse populations. Can we develop kind of collaborative practice networks or research networks, so that, again, we can have a kind of really a more systematic way of collaborating, sharing information, testing interventions, doing this work. So, and again, we don't want to reinvent the wheel, and we kind of want to share the knowledge. So can we create collaborations or collaboratives that help us do that a little bit better? There was a lot of conversation also on the last breakout around refugee health. Thank you for Dr. Thadi, who's talking about, experiences in terms of capturing accurate medical histories from patients who are refugees and leaving kind of challenging situations, and the specific example was having patients who are saying that they are one age but they're presenting as older. Is that a matter of kind of premature accelerated aging because of stress and trauma or weathering, or is the medical history inaccurate? Is there something getting lost with the interpreter or in translation? And because all those things, kind of verifying even age and certain aspects of people's background, have implications for preventive care, for screening. And one of the things we talked about is just certainly doing some sort of environmental scan on kind of best practices in terms of serving refugee patients, aggregating that information for our local providers so that we have those resources more readily available. I know she's been working on a curriculum around this for our medical students and for other practitioners. And again, we don't want to reinvent the wheel, but we talked about looking for other resources to complement or support that kind of work. What are the best practices in getting new information, getting information from new patients, from immigrant patients, from refugees? And again, can we aggregate all that to serve everyone? So those are some of the topics that came out of our group. Did I capture that? Anybody from our group, if there's anything I'm leaving out, please add.
Very thorough.
Yeah, you got them all, Dr. Thompson.
Okay.
You got, you got them all.
Okay,
Thank
cool.
you.
Okay. So it's 7:51. So I'm going to turn it back over then to Mediha and Maha to kind of wrap us up and get us ready for tomorrow.
Thank you so much. What a wonderful discussion. And really what I think I appreciated seeing was the diversity in experiences and opinions in this group. And really, I want to kind of re-highlight what Dr. Thompson said. Like, we have some amazing researchers that presented their work today. And most of all, for the respect that Wayne State and the academic community has for the community scholars, the people who have, may not have the degrees, but they have the experience, real life experience that they bring to the table. So thank you for creating this platform, and thank you for all of you who, have really helped us to create a collective decision-making forward on what we're going to do with this group. Tomorrow, we are going to have a similar structure, and where we're going to have, talks followed by breakout. Now you guys know the drill, so hopefully it's going to go smoother, a lot smoother tomorrow. We will be hearing a lot more from the community. Our goal tomorrow is to cover equity as well as policy, and we're going to be bringing folks from health departments, from people who've done a lot of work on data disaggregation, talking about data invisibility and equity. So it's going to be a very exciting program. We will start promptly at 5 o'clock, so please don't be late. And then, yeah, and with that,
actually, can I add something? Because I think I might have provided some misinformation in the chat. So excuse me, Carrie and Alex. So for the work groups, are those dates already set? Because I wasn't aware that they were.
Yeah, Madiha, Maha, and I had said we already have the standing lunch meeting from 12 p.m. to 1 p.m. We were meeting every 2 weeks, and why don't we just use that, because we already have it blocked in our calendars, to meet as a research network, and that will happen the second Wednesday from 12 p.m. to 1 p.m. If we will have your email address, you can reach out to Alex. You can also check the checkup website, and we'll be following up with announcements about that. We wanted to make sure that was in place for everybody to join, and I'll hope that we'll share that again tomorrow at the end. And if I can just say one more thing, Haley, thanks. The evaluation link is in the chat. It's really important that we collect that information to make the case that this event and space is useful and important. So please do complete it. We appreciate it. Back to you, is Madiha.
Yeah. So, and for my non-researcher, non-PhD friends who are like, what just happened? Like, we need you here. There's an old saying that my grandmother used to say, you can't clap with one hand. Like, we need the researchers and we need the community to make this happen. Otherwise, we're not going to make enough noise to make a change. And why are we doing research anyway, right? We're doing research to make a difference, to change policies, to be heard, for narratives to be heard. So I hope that even if some of this stuff like went, over our heads, like, come back and don't ever think that your opinion is like not valuable, because you are bringing a very unique perspective. So I hope my community friends, my undergraduates, those folks who may not have a ton of experience in the MENA community and research are going to engage. I'm going to hand it to Maha. I don't know. Maha,
I'm just following up for the evaluation, because we have a large number of people left before we put the link. Can we send that to everyone participated or attended today, just to make sure everyone?
Yes, we will send it via email.
That's great, because we lost around 40 people before we send that. So it would be great if we include their feedback. Thank you so much, everyone, for your participation today. We appreciate your time spending your evening with us, and we'll see you tomorrow. So thank you, everyone.
Hi.
Have a great night.